And while the world deals with the COVID-19 pandemic, healthcare advocates say racism is a public health emergency.
They say the issue is people of color have a lack of access to care and health insurance. 13 News reporter Mike Militich has more.
The maternal death rate for Illinois' minority community is a major concern for experts. Doctors explain black women are 6 times more likely to die from pregnancy-related issues compared to white women. They also note Hispanic women are twice as likely to die during or after childbirth.
This in Illinois is much higher than the national rate. So this is something that we cannot sacrifice.
SEIU Healthcare explains some of the state's hospitals have billions in revenue, while safety net facilities must make decisions on types of care available for their patients. Vice President and Director Ann Igo says the COVID-19 pandemic left hospitals with no option but to shut down essential services in order to serve COVID patients. Many hospitals were able to bring those services back, but safety nets couldn't.
We have funding challenges for safety net and critical access hospitals. A difference of $100,000, a difference of $200,000. When they don't know exactly the amount of funding they're getting, they can't plan for the future.
Other advocates noted hospitals across the country have structures where healthcare is secondary to profit.
The United States typically ranks about 37th in the world in production of healthcare outcomes, while far and away ranking first in healthcare expense. That's the difference between an industry and a system.
Dr. Sterling says hospital closures and disparities in healthcare outcomes are too often predictable consequences of for-profit business models.
That was Mike Militich reporting. The Department of Healthcare and Family Services has renewed its focus on listening to customers to learn about their needs and worries about lack of care in communities.